what I was just talking about. Calculus, aka tartar. If I take my fingernail and go like this on that one, it's not going to be on my fingernail because it's not soft anymore. So this is when it's hardened up. So they have to come to the dentist and get a professional cleaning. But, like I said, we can clean that off. Doesn't that look nice?
No.
Exactly, it does look so great. All right, something needs to go right there, though, I think. Something's missing there.
There's a question.
Oh, yes, okay.
Alright, so you know how when somebody gets permanent grills or like veneers, do they really trim their teeth?
Sometimes. Yep.
Can the
Sometimes.
ears come out like if you buy some?
If it's not put on there with permanent cement,
But like if it is, like it's possible for it
it
to
shouldn't.
come out.
It shouldn't, but it's possible for different reasons, but it shouldn't. All right. I'm gonna let y'all read over this list, and I just hope that none of this is you. But periodontal disease, warning signs, bleeding gums, persistent bad breath, pus coming from your gums. All right. So take care with this list. All right. As we discussed, though, regular checkups. Is it everybody in here get a regular checkup?
When's the last time everybody's been to the dentist?
I went last month.
3 years. I heard 5 years.
But does anybody know how often we do recommend you go, though? Because I was going
I think you go once a year.
Okay, I do prefer the every 6 months
Yeah.
thing.
I go
But if you don't have any cavities and you feel more comfortable with the once a year, I think that's okay. But every 6 months, though, is what's recommended. So who should go to the dentist?
Everybody?
All right.
Just to make sure you don't got nothing going on.
Okay, who should go? Absolutely. You know what? I will give you an application. Come work with us. Okay. Everybody should go to the dentist. Young people, old people, white people, black people, every race, every nationality, every age group. When it's little people like this, we are not particularly expecting this guy to have a cavity per se, but we want to get him acclimated to coming to the dentist. We don't want his first visit to be because his mom had to bring him because he had a cavity once he was 8 years old, and now his first experience is something traumatic. We don't want that. We want his mom to bring him when he's this little. We're going to take a look at his little baby tooth. We're going to get him used to coming into the dentist and realize that coming to the dentist is not anything scary. And so we'll kind of see him over the years and kind of just help mom know what to anticipate and when teeth are coming in, etc. Old people come to the dentist too. We want grandma and grandpa at the dentist. Even if they don't have any teeth, we'll see them once a year, make sure that their dentures are okay, make sure they don't have that, what we saw in the corners of the mouth. Anybody remember what that was? It was thrush and candida. Make sure they get their dentures okay, make sure they don't have any abnormalities on the gums, assuming they don't have any teeth. A lot of people keep their teeth longer and longer though. Handicapped people or special needs, anything, anybody. Everybody comes to the dentist. Doesn't matter. I'm coming to the dentist. Oh, who are these people? It's your school. Y'all know these folks? Y'all know these people? Even these people come to the dentist. Who's this lady?
That's Miss Smith.
Yeah, that's Miss Smith.
I did a tree.
Yeah, everybody comes to the dentist. Even the Crimson Wave, y'all the Crimson Waves come to the dentist. Who are these people?
Kiki, Tati.
They come to the dentist. So teenagers come to the dentist. That was my point here. Teenagers come to the dentist. High school kids come to the dentist. Oh, who are these
Trail
people?
Harper.
Oh,
Fucking
Crimson Wave.
fucking
Watch them out.
okay. Trail Harper.
All right.
Trail
So
Bird.
when you come to the dentist is going to check your teeth. And again, good oral hygiene, good nutrition, and being what? People in the back, smokers in the back, y'all gonna be what? Y'all are gonna be what?
Tobacco free.
All right now. No smoking and no what?
Drinking. Oh, vaping.
No smoking and no vaping. And y'all look for a program. And what's this? No this either.
Oh yeah, the cans.
You know what's gonna happen to you. You know what's gonna happen to you. Know what? Know what?
Blunts.
No blunts. No blunts.
Said that loud.
Right, that's a cigar though. I put it up there because it's a cigar. No cigars and no what? No pipes of any kind. No, none of that. Let me say this, ninth graders. You guys quit smoking today, right? They're like, No, I just mean the people who say they smoke. They quit today. All right, so in terms of how to brush your teeth, I think a lot of people make the assumption that they know how to properly brush their teeth, but I do advise that you guys look at the little diagram that's in your handout there. Very good. Very good. And were you one of the smokers?
No.
Okay, good. Good. Perfect. Perfect. So you gotta watch your breathing. Okay. But anyway, small amount of toothpaste, and they want you to brush all the surfaces of your teeth, and including your what? Tongue. There you go. So you don't get all that coating on your tongue. Healthy foods. Oh no, these are foods that damage your teeth. Oh God. Okay. Foods that damage your teeth. All right, great. What's that? Well, the thing is about breads is that it breaks down into carbohydrates, which breaks down into sugar. And again, the sugar it could be an issue. All right, and then having healthy foods is where it's at. Pregnancy and oral health. This slide was in here for another presentation that I did, but it was just making the point that you need to be healthy and have good oral care during your pregnancy. I don't expect that anybody here is pregnant, but I mean that is a reality sometimes for some people. And so when people are pregnant, they still need to have good oral health care. Not having good oral health care during pregnancy has actually been linked to preterm labor and low birth weight babies when they're delivered. Just so you can share this with your parents and your older siblings, which trimester, you know it's 3 trimesters to have a baby, which trimesters is the best one to have dental work done? Do you know? First. Absolutely. How did you know that? Is it safe to take x-rays on pregnant people?
No.
I usually
It's
try
too
to.
much radiation.
Oh my God. Y'all know what prizes? You're right. I try to avoid doing it actually. But if somebody has a toothache, I will put lead aprons over them and things like that, and I will take an x-ray of a single tooth that's bothering somebody. Because if somebody's pregnant and they have a toothache, I think that's more dangerous than not taking care of that toothache. All right, and same thing, just belaboring the point that your oral health affects all of your body. Bacteria from your mouth gets in your bloodstream and travels to your heart and can cause something called endocarditis, okay? Inflammation of the heart muscle, of the heart muscle. Okay, nutritional and vitamin deficiencies in oral health. All right, men and women who don't get a lot of calcium get gum disease. Oh, and look at that. Evident, especially in young adults. You guys are young adults. All right. Patients with high triglycerides. You know what that means? Patients with a lot of fatty stuff in their bloodstream. A lot of cholesterol, you know, from eating a lot of fast food and things like that. those patients, they also have a lot of loss of attachment around their teeth, meaning it can make your teeth loose.
Ms. Brown,
Mhm.
I didn't know they had names for each tooth.
Yeah.
It's central incisor.
Central incisor.
Yeah, my bad.
Where do you, can you guess where that is?
It's like down like at the
Well,
bottom.
well, the central incisors are the front teeth, the very front teeth. Does anybody know where the canines are?
Right here.
That's the ones y'all call y'all's eye teeth. The canines. Yeah, the fang. There you go. Right here. Yeah. Yeah, this is not a good example, but they was right here. But here's the central incisors though, y'all. Here's the central incisors. Okay, that's good though. That was right on time. Let's get it in application. Okay, vitamin C deficiency, also known as what? This is a hard one right here. If you get this,
Wait, what did you say?
I think y'all just, alright, if you get this, I don't know. Vitamin C deficiency, also known as what? What? Did you say it? I think you got it right. What?
What's scurvy?
Yes! That's so good! She get a prize. She knew that. That's so good. Oh, man, I'm so proud of you. Vitamin C deficiency is rare. It's very rare, but that too can cause gingival bleeding and tooth mobility. Wow, I'm so happy about that. All right, same thing, respiratory ailments. You're breathing in through your mouth and nose. Bacteria is all on your teeth and all messed up in there, and then it's going right down into your lungs, causing problems for your lungs, pneumonias, COPD, even associated with COVID and things like that. People with gum disease, almost 5 times more likely to have some kind of respiratory issue. Just keep that type of stuff in mind. Next time you get sick, you're like, oh, what's going on? Okay, cancer and oral health. Almost 60,000 people in the United States are diagnosed with oral or throat cancer every year. This is a type of cancer. We see things like that in the office. We refer these patients to get this biopsy.
If you get mouth cancer, can you not eat?
Most of the time, people are pretty resilient, and every time something's wrong with people's mouth, they still figure out how to eat for the most part. But I think when you're undergoing a lot of these treatments and things like that, it's very painful for people to have to eat with conditions like this. One of them is right here, painful mouth and gums. All right, so I think I have beat this dead horse. The link is between your oral health and the rest of your health, right? The health of your entire body. Okay. Anybody have any questions?
No, ma'am.
And if you think of something, you can always call the office or email me. Who wants to be a dentist now after this? You can get to see this stuff every day.
Do y'all know Dr. Brown is here every Friday?
Oh yeah, I'm here every Friday at the Free Teeth Clinic.
So do y'all know she can clean your teeth here?
Yep.
Do you all know how to do that?
No.